Whether you're visiting a dentist for the first time or considering a new one, the more you know about who's behind the chair, the better your experience will be. I'm your host, Eva Shea, and on Meet the Dentist, we feature professionals sharing their expertise so you can feel confident about who you trust with your smile. My guest today is Dr. Shawn Javid. Did I say it right?
Perfect.
Oh, good. He's a biological dentist in Los Angeles, and you're the first biological dentist to be on the show. Welcome to the podcast.
Thank you for having me.
Is that a well-known specialty that just I haven't heard of, or can you give us some background on what biological dentistry is?
That's a great first question because really most people don't know what biological dentistry is. There isn't an actual specialty. It's actually, I would describe it more of a lifestyle. It's not something that you can take a weekend course on. It has to be something how you live your life. Now, what I mean by that is it's a belief system more than something like you learn. Like, let's say in dentistry, you want to learn how to do dental implants. You take a few courses, you learn how to do it. You learn how to do cosmetic dentistry. You learn how to do, let's say, root canals. There's specialties in oral surgery or anything else. These are all things that you can learn how to do. With biological dentistry, it's not about, you might learn specific things, like, let's say, safe removal of mercury fillings. That's something that we're not taught in school. So we go and learn to get certified of how to remove mercury fillings. So that's something that you learn to do. But overall, it's more of a philosophy. What I mean by that is there's maybe three main aspects to this philosophy. One, you are looking for a root cause of problems instead of addressing symptoms. When we are treating patients, let's say we see cavities, we want to go ahead and fix the cavity, right? That's treating the symptom. But for us, besides saying floss more, we might look deeper into to see that what's the microbiome of the oral cavity. If there's something off, you might see there are mineral deficiencies. Like a lot of times, if someone's low in vitamin D, they're likely to get cavities. So we want to look for what's off that someone is getting cavities. You're not supposed to get cavities. So looking for a root cause is big, and I can give you other examples of that. Another one is we are very much focused on the mouth-body connection. The mouth and the body are connected in many, many ways. We are not only through the blood vessel and lymph and veins and things like that, but also meridians, which you might be familiar with meridians because you interview a lot of doctors. But the meridians, like Chinese medicine, you're connected, and mainstream medicine really treats the body like a car. You change the wheels and you change the gear shifter or something like that. But really, the body is so connected that everything, the skin, the heart, everything is related to each other. So if you have, for example, a source of toxicity, which the mouth is often a big source of toxicity that causes chronic health issues, it shows up in your heart, it shows up in your skin, it shows up in different areas of the body. So if you're not looking at the body as a whole, then you're missing the boat. And we're very choosy about what materials we use. So we don't use metals, for example. We don't do some certain mainstream treatments. I don't really do root canals anymore. We look at how things or materials or treatments that we do that could be affecting the body in a negative way. Not a quick answer, but it's like I said, it's like a philosophy, very similar to functional medicine or integrative medicine, where you're trying to avoid prescriptions and really look for root cause of problems and getting patients healthier from within to achieve the results, not just fix problems superficially.
Let me give you some practical analogies to maybe confirm some of the things I heard you say. So the meridians, like my husband just had shingles, and that only affected one half of his body because of somewhere there's a center line, and shingles doesn't appear on both sides. It only appears on one side. Is that the same thing?
A little different. I would compare that to, have you ever had acupuncturists on the show?
I have not done that yet.
Okay. Well, you know of acupuncturists, I'm sure. Have you ever been to an acupuncturist before?
I haven't, but I am probably a very rare person in that I almost never need medical care for any reason. So I just I've never like needed to go find an acupuncturist for any reason. So.
Well, wonderful. I mean, the thing with acupuncture, they work with meridians, they work with energy lines in the body. And what they do, for example, if you have a back pain or a neck pain, they might put the needles in that area, but actually they'll also put needles in your hand or in your feet, because there's these energy lines that go from the top of your head to your feet and into your hands. And these energy lines are aligned with, for example, each teeth has different energy lines. So you can have blocks in that energy, and depending on certain restorations in your mouth, like metals and other things, it can show up in your big toe. You can have pain in your big toe, or show up in your heart with heart. Like I had a patient that for 20 years, she flew in from New Mexico. For 20 years, she had heart palpitations, and no one could figure out why, because they kept looking at the heart and nothing was wrong there. But what we found was that she had major infections in the back molar areas on both sides. And these infections were on the heart meridian. When we took out the sources of the toxicity and the infections, that day her heart palpitation stopped
Immediately.
immediately. We're connected in so many ways. Our bodies are, and we are also, but our bodies are such a fluid system that's connected in so many ways. Logically, if you think about it, it makes sense. But mainstream medicine doesn't treat it that way. They treat body in silos, you would call it. You're like the heart specialist, and that's all you look at. You're the skin specialist, but that's all you look at.
Yeah.
You're an eye specialist, but that's all you look at. But really, you have to zoom out. We believe that you have to zoom out and look at the whole body and look at the whole person, because the problem can be coming from elsewhere. Now, it could be from the meridians, but it could be also just, you have an infected root canal and the bacteria is just constantly going into your bloodstream and lymph and going through your whole body and causing problems everywhere else in your body. It could be causing skin problems. It could cause a lot of health issues are related to toxicity that's coming in from the mouth.
What kinds of things are you able to figure out about what might be going on with someone if they have, from your earlier example, if they have a lot of cavities and that's not normal? It's not normal for anyone to get a cavity, much less multiple cavities. What do those point you to? What do you look for?
There's a few things to consider. Number one, as a biological dentist, we want to do the least invasive procedure always. We want to touch the body less. For example, we want to avoid doing bigger restorations like crowns whenever possible. We do something else called on-laser or partial crowns. And we're choosy about the materials that we're using. So not only, we might do a filling, let's say, everyone has had a filling before, whether we don't want to use obviously the metal and mercury. Everyone already at this point knows that, which unfortunately we're still putting in this country. Other countries have banned it, but here we're in this country, we're still putting mercury fillings in people's mouths, which is crazy. But even the white fillings that most people would go to as their first choice are usually made with plastics inside, and they're called composite resin fillings. These plastics that you might know, plastics release something called BPA, which is toxic to the body and causes a lot of health issues. You have to look for it, but there are some white fillings that are not made with BPA. So for us, as a biological dentist, we want to go look for those specific type of materials that are least toxic to the body. We'll use porcelain whenever possible instead of even that resin composite filling. And we'll use, again, the most biocompatible materials so that we're not leaving a footprint, we're not affecting the body. So the body, a lot of times, is toxic from just what we've done in humanity to try to fix things, and we're making it worse. So our goal as a biological dentist is to remove sources of toxicity, not add to it. Remove sources of toxicity, because many times problems, health issues, autoimmune disorders, cancer, this is due to a toxic load burden that people are living with. And this toxic load could be coming from different sources, whether it's heavy metal toxicity, infections of different sorts, environmental toxins, microplastics, hormone disruptors. All these things are toxicities that are coming into the body, adding to our toxic load. Now, people in the health industry, obviously, especially people that are in the longevity and biohacking and wellness industry, are trying to reduce the toxic load by doing like red light therapy, saunas. You've heard of people exercising, eating better, eating cleaner, having water that's filtered, don't drink, you want to be very choosy of what you're putting in the body, right? And you want to detox the body. You want to do heavy metal toxicity, liver detoxing, all that stuff that you might have heard about is ways to get the body cleaner. But now imagine you have a source of toxicity that's constantly seeping into the body still. Like imagine if you lived in a moldy home. If you live in a moldy home, everyone understands that you're in a toxic environment and constantly you're breathing in the mold, right? If you have a toxic source coming into your body, which a mouth a lot of times has from different ways, however much you try to clean the body and get healthy, you can't get too far. You have to get rid of the source. So for us in biological dentistry, we work a lot of times with integrative doctors. We're kind of the bridge between the mouth and health care. We're working with them to actually help patients on their health journey, not just fixing their teeth so they're out of pain and functional, or maybe even making their smile better, which is fine, but it's more about an overall health perspective. Does that make sense?
Yes. There's an interesting parallel here because in aesthetics, which is where I've spent most of my time and know the most random stuff, there are people who with implants in other parts of their bodies, lots of different kinds of implants, even hip or knee or joint, but also breast implants and anything where a biofilm can build up or the body can react to the material. And it happens to some people and it doesn't happen to other people. And they're spending a lot of time trying to figure out what triggers that. And so there's a whole side of aesthetic medicine where people are removing implants because they're making some people unwell. You would not have a practice if there was no demand for your services. And so what I'm curious about is if you've seen more and more demand over the recent years for this kind of dentistry.
Absolutely, yes. People are starting to question things more. And what we encourage is for patients to be their own health advocate, meaning I tell patients, you should not listen to any doctor. You should not listen to me. I'll give you information, but you have to do your research. You're the driver in this journey that you're on your health journey. And no one is here to tell you what to do. You have to actually do the research. Now, COVID helped. COVID helped a lot because, we were misguided. When you're pushed in a certain direction with mainstream medicine as your guide, well, the science is not settled always, as we were told. So the reality is that people started realizing that, well, you know what? I have to think a little bit. I should not just blindly follow. I have to do my own research. And if any doctor tells me to just listen to me and don't question what I'm saying, that's their issue. So for us in biological dentistry, we're here to really marry ancient tradition. A lot of times, like we're talking about with meridians, and this, which is thousands of year old traditions from Chinese medicine or Ayurvedic medicine, like coconut oil pulling. This is an ancient tradition that's been done in thousands of years that I recommend quite a bit. And then we marry that with current technology and current research. Now, we don't just do things the way we were taught in dental school. We look deeper and look further and seeing what is the current way to do things. I was taught to do mercury fillings in dental school. When I graduated, I never chose to do that because I thought to myself, hey, you know what? They're made with more than 50% mercury. Does that make sense to put that in the mouth?
That
Even though they
bothered
told
you?
us,
Even in school, you were like, why are we doing this?
yeah, it
Yeah.
doesn't make sense. If I tell you, you don't have to be a doctor. We're putting a material in your mouth that's made with more than 50% mercury. Well, they told us in dental school to convince us that if you mix these different metals, it's 50% mercury. There's other metals. Altogether, it's called an amalgamation. That's why they call it an amalgam filling. Amalgamation is a mixture of all these different metals together. Then the mercury is not released anymore, which is totally false. If you YouTube a video called The Smoking Tooth, it's amazing. You and your viewers should do this. The Smoking Tooth, you'll actually see a video using fluorescence. They have a tooth, an actual tooth with one of these, I don't call them silver fillings or amalgam fillings. I call them mercury fillings because that's what they are. They're rubbing it, and then you see the mercury fumes coming off of it. And that's what we're inhaling constantly every day when you have a mercury filling in your body. Every time you chew your food or you brush your teeth, you grind your teeth, it's being rubbed. And this mercury vapor is constantly being inhaled, causing heavy metal toxicity. This heavy
Forever?
metal toxicity leads to constant toxic burden, major health issues, psychological, it's a neurological disruptor. So these are things that we have to be thinking about. But again, we're just told to don't think. just do. For us as a society, what we're encouraging is to start thinking.
So if you get them when you're little, like, I'm all, pushing 50 and I still have a few from when I was a small child. Those are still like off-gassing mercury
Yeah,
to this day?
every day. Every day. In fact, the older they are, usually they're releasing more mercury. It starts breaking apart a little bit. There's more surface area, and what happens then? It's actually releasing more and more mercury. But I would not say go and take them out.
No. That was my next question.
If you go to a conventional dentist, they would just drill out that mercury filling like it was a cavity.
Yeah.
You'll say, I don't want these mercury fillings. They'll go drill it out. And when they drill it out like it's a cavity, what happens to that mercury vapor? Imagine you're rubbing it causes that mercury vapor. Now you're drilling it with this high speed drill. All that mercury particles and vapor is going in the air. You can't smell it. You can't taste it. You're inhaling it. The doctor and the assistant are in that room are inhaling it. Toxic for everyone. Very toxic. In fact, people a lot of times start getting sick when they remove the mercury fillings. So they have to actually be removed by a trained biological dentist, certified in removing them correctly. And not only for your protection, but for their protection.
Well, they're exposed even more than you are because if they're doing it over and over and over.
Over and over again. For the first half of my career, I was a cosmetic dentist. I did a lot of new smiles for people, and I removed mercury fillings all day unsafely. So now we have strict protocols, safety protocols for the patient, for us binders to grab this mercuries. There's different vacuum systems set up inside the mouth, outside the mouth, draping the patient completely because mercury vapors that are going up, it comes on their skin. Even if you have a glove on, it can penetrate the glove, goes in your system. So you have to have these vacuums. Patients rinse with these binder. There's a whole protocol that you have to do. So I always tell patients, you know what? Don't take them out unless you're doing it correctly.
Has anyone ever looked at dentists of an older generation and what happened with their constant exposure to mercury?
Oh, yeah. I mean, we know what happens with mercury exposure constantly. Your body actually absorbs this mercury or toxins from, let's say mercury right now. They pull it out of your blood because your body naturally has this intelligence, realizes it's toxic, and wants it not be circulating throughout your whole body. So it pulls it out of your blood and it puts it in the holding area. Now, the holding area usually is fatty tissue. Now, fatty tissue is a safe place to store it. So it goes into the fatty tissue cells and it stores it there. That is why when people actually have a high toxic load, they can't lose weight very easily. They will gain weight and they're like eating great and they're eating well, but they can't lose weight. The body is holding on and doesn't want to let go because if it lets go, the mercury will come out of the bloodstream again. So, but over time, that bucket, let's say that holding area, that bucket gets full. And as more and more toxic sources are coming in, you're getting mercury from, let's say, not only your fillings, from maybe fish and other heavy metals. That bucket gets filled. At one point, it will spill over. Now it'll go into your organs. So now from there, it goes into kidneys, liver, and your brain. So one of the things that happens, you get neurological issues. So a lot of times memory issues, fatigue, brain fog, a lot of these things are related to actually mercury toxicity. These are things that we sometimes attribute to old age, but actually it's because of your toxic load. So, and of course, don't forget, there's Alzheimer's. This is all neurological disorders that because mercury is a major neurotoxin, one of the most toxic materials in the world. If you have a little spill of, let's say, from an old thermometer, someone with a hazmat suit should clean it up.
Right.
And in fact, this is interesting. If we are cleaning out the mercury out of someone's mouth, there's no regulation. We just talked about of us being protected, the patient being protected. There's no regulation on that. But you know what is regulated? It can't go down the drain. The mercury cannot, by law, every dental office has to have something called the amalgam separator, which means that when it goes down the tube, before it goes down the drain, it has to be separated with this machine So it doesn't go down drain because they know how toxic it is for the environment. This is the reality. Guess what? In the 70s, the late 70s, Russia banned these mercury fillings.
In the
Late
70s.
late 70s, right? Europe, many countries have banned it. As of 2025, all of Europe has banned it. And here in this country, zero regulations. We're still putting it in. Kids, pregnant women,
Yeah.
everyone, you're given the option of putting a mercury filling in. So again, as a biological dentist, these are the things I like to think about and not just do it because I was taught in school. You have to think about it and say, does this make sense? No, you don't have to be a doctor to realize that doesn't make sense. A lot of the things that when I explain things to patients, they're like, oh yeah, that doesn't make sense. But if I try to talk to a doctor about these things, a lot of times they will not have it because they have to relearn something.
Too much cognitive dissonance. I have 2 little girls, and they both have been going to the dentist since they were tiny because everyone puts you on a very strict schedule and they're very stern with you about what you have to do with your kids. These last 2 times, they don't go at the same time, but pretty close together on the schedule. This time, when they asked me about the fluoride varnish, I said, hold on. What is this? Because what they do is they're real cute and they're real sweet and their faces are never showing. They're always like completely covered up with multiple things on their faces. It's like almost like there's no accountability because they're practically anonymous. And they say things like, is she going to be okay not eating for 30 minutes after her appointment? Because we're going to do the vitamins. And I was sort of like, yeah, whatever. Because the question was, is she going to be okay not eating? I said, no, she's not going to eat in the next 30 minutes. But then I went, wait, you're talking about the fluoride varnish again and you're calling it vitamins? And I was like, no, we're not doing that today. Not because I'm against it, because you have not given me the information that I need. I didn't let them do it these last 2 times. The first time they gave me a piece of paper and it was like toxic. Do not let this get on your skin. There's like this whole page of all these scary warnings for adults and kids. And I'm thinking, you want to put it in her mouth, but she can't, like nobody can touch it? What? So I meant to go do more research and I didn't get around to it, but I said no that day. And then, so next time comes along and this time I'm on to them and I'm like, no, you guys haven't explained to me exactly what this is or why you're doing it or why she needs it. You have given me no information and I don't appreciate that you're tricking me by calling it vitamins. So I do want to ask you about fluoride varnish because there's been a lot of talk about fluoride in the news because of Secretary Kennedy and other people bringing it up. You're here, and so I'm going to want your take on this.
Well, fluoride is a big deal. In fact, there was recently a federal court judgment against fluoride. This was a big win for holistic medicine and functional medicine and biological dentistry because we've all been shouting fluoride is toxic. It's been proven to reduce the IQs of children. It's a disruptor in your neurological function of the child. And for us, they say they put it in toothpaste, but you're not supposed to ingest too much.
Right.
I mean, realistically, how does that mean? Anything you're putting in your mouth, you should be able to ingest as much as you want. If it's a little toxic, why are we putting it in our mouth? There's been some studies that show fluoride topically can reduce the chance of getting cavities. Let's say it does, okay? So we're going to, for the sake of preventing cavities, we're going to put some toxic material in your mouth. We know it causes neurological problems and developmental problems. And we know 100% it will reduce, it's been proven to reduce IQ. Why does this make sense? Again, can we maybe prevent cavities in a different way? Maybe we should eat healthier and avoid these certain toxic things that are causing an imbalance in your oral microflora. And maybe we should strengthen the teeth with some really important micronutrients, making sure that there's a balance in not only, again, with your nutrition. When's the last doctor that talked about nutrition? And if you're not thinking about talking about nutrition with your patients and just trying to make them better with prescriptions and fluoride, are you really doing a service for your patients? Most doctors are pretty toxic people. They're not even focused on it for themselves at all because it's never taught in school. Nutrition is really not taught. And in fact, it should be probably a biggest chunk of our knowledge coming out of school should be about what are foods that we eat, what is a really balanced diet, not this crappy food pyramid that they taught us that has that sugar and processed foods and the current American diet that has caused tremendous health issues. In fact, we're the most unhealthy people in the world, and we spend more money on healthcare than anyone else by far. And this is not up for debate. This is a proven fact. And why is that? Because big food, big pharma have complete control. And this is a money-making system. The reality, I'm sorry, but this is not a conspiracy theory. We are, as Americans, having certain foods that are so toxic, that are so inflammatory, that are constantly messing up our oral microflora, gut microflora, these things that are causing then physical problems, mental problems, all of it is related to each other.
There's a growing movement in aesthetic surgery, which, I've already said, I spend most of my time talking to those folks that they're doing a much better job preparing people for surgery with nutrition, both before and after, because they get better results.
Yeah.
If their nutrition and their protein intake is dialed in. In retail medicine, the dollars are what motivate everyone. And so that's actually kind of one of the nice things about it. I want to go back to where you said you spent the first half of your career as a cosmetic dentist. What happened to make you switch over and say, I'm going all in this biological dentistry?
Great question. It wasn't a switch. It's a lifestyle, like I was saying. So what happened is, I've always been into health and wellness and fitness and as a person, and also into personal development, peak performance. In our home, my wife and I, for our kids, we're conscious of what we buy, and what we put in our home to be eaten. And we're conscious of other things around us, our EMF, any kind of source of toxicities that are come by. The more and more you're conscious of these things, well, it naturally spills over to how you want to practice, because then you're thinking, you might start with, an obvious one is you might start with the mercury fillings. A lot of times dentists call themselves holistic or biological because they went and took the course of how to remove mercury fillings safely. Okay. Now they consider themselves a biological dentist, but really you're not. You're not looking at really the nutrition of the patient. You're not looking at the micronutrients. You're putting implants that are metal, in the body. We don't do that. We use ceramic implants. Again, it's a lifestyle. So it was a gradual thing. As I kept diving into that world more, I started going to different conferences that were for teaching more biological dentistry. And when you start learning more and more, and then your practice starts evolving. And then all of a sudden you realize, I don't believe in the old ways at all. I'm not doing anything like that. You're not that person you were, 10 years ago. So you don't live your life that way. You don't practice that way. It's a gradual thing, and it actually never ends. So it's a constant evolution. If you're a great biological dentist, you're constantly evolving.
And you work with your brother now, right? He's your partner at work?
Yeah.
How did that happen?
Well, he's my older brother. He started 7 years before I did. He wanted to be a dentist before me, and he said, I wanted to be a medical doctor. And then he said, you know what, you'd be great in dentistry because I have an artistic side, and that's why I did cosmetic dentistry, because I like the artistic side and I like working with my hands and so on and so forth. So he said, you'd be really good at it. After further research and volunteering and things like that, I decided to go to dentistry as well. And it was a good choice for me. And then we had a vision of creating this high quality cosmetic dental practice. And we did for years a lot of cosmetic dentistry, full mouth reconstruction. And we kept expanding our knowledge in different surgeries and implants and sleep apnea. We got a diploma in sleep medicine. Doing sleep apnea is a big one, overlooked, causing major health issues that we should talk about as well. Constant evolution led us in this direction to ultimately holistic. Luckily, our vision is very aligned, and we want the same things, both personally and professionally. We're on the same page. We're very close. Our families are very close. We live close. We have the same friends. We tonight we're having poker night with the guys. So It's a great dynamic. I'm blessed to have it, definitely.
It's wonderful. It's very unusual too.
Yeah, again, it's definitely a blessing, and we don't take it for granted. So it's a special thing to be able to have your partner as your brother and be aligned in vision and in direction. And we were big into the wellness world, longevity world, and biohacking world. So we decided this past year to build a brand new facility that encompasses really a vision of what we feel is what should be the future of not just oral health, but healthcare. We really can work collaboratively with healthcare professionals of all kinds. So in our facility, that's why the name is called Smile Body, because it's the mouth and the body together and looking at it from that way. So we built this facility where we not only are doing biological dentistry, we added it for kids. Yes, we have a holistic pediatric dentist department for the kids now, but also we have a medical side where we have integrative doctors, naturopaths, and nurses, IV therapies of all kinds, hyperbaric treatments, red light therapies, and infrared, different laser treatments of all kinds. And there's therapies using current technology with integrative medicine. And even we have an esthetician that treats the skin in a holistic manner to get it healthier, to look better. Putting it all together in one center, it's a big center. For us, it's the way to go for the future of healthcare. It's this collaborative approach.
I think what's so nice about what you've done is that you've lived it and you're backing it up. I see lots of people stand up facilities, but this seems so organically grown from your philosophy that somehow it feels different. I don't know.
Well, Eva, it was not a business decision, if it makes sense, because we had a 2,500 square feet office with lower overhead, and we were doing fine. We decided to go to almost 7,000 square feet, but we felt like this is what we have to do. It wasn't something it was something that's necessary. And it was more of a passion. This was a passion project for us that we were driven to. And in every step of the way, I have to tell you, it was like the universe was aligning to help us make this happen. Certain people, when we thought that we're going to have a hurdle here, certain people would come in just in our world, things would happen in the right way. So it became a natural momentum in this direction that we were riding a wave. It wasn't us driving the bus kind of thing. It was just, we were part of something bigger. Now that it's fully functional, we are part of something special. We're not a part of a movement. It's not a business. This is not a biological dentist office. It's not a wellness center. It's a whole different concept. We don't have a name for it actually, but it's a concept that we feel and we speak on. I speak at conferences this weekend. I'm going to be at a conference speaking to get this message out to healthcare providers of all kinds, to people that care about their health, that the true way to health, a lot of times you have to go through the mouth, and the mouth is many times the source of toxicity that's adding to that toxic load.
So many people are just completely disconnected from what goes into our mouths. It's almost like you've restored the connection.
I mean, it's only natural. I mean, everything we're saying right now, it makes sense, right? Logically, it's intuitive. It's not like I'm telling you something that doesn't make sense. It's just intuitive. The best things in life, it's stuff that you go, well, this basic knowledge, it's not complicated. And for the kids, I want to touch upon that a little bit, because the reason we created a clinic inside the office for just pediatrics, and we hired Willie, we're so lucky to have an outstanding biological dentist that's a pediatric dentist on the team for just kids. Because what she does is not only try to make the experience wonderful and prevent cavities and hygiene and all that kind of stuff and make the experience much, much better, but also she is about development of the job. She is about, and some of our philosophies about airway, which means for kids, a lot of times these kids, it's overlooked, but they have collapsed jaws. Their maxilla is collapsed and there's not enough space for them to breathe at night. A lot of kids actually have this problem. They have enlarged tonsils, enlarged adenoids, which is related to diet, by the way. And these enlargements and collapsed arches are making it where they can't breathe well at night. And guess what happens at nighttime when you're sleeping? Growth hormone release. And growth hormone causes mental and physical development for these kids. Now you're getting these kids that are not growing properly mentally and physically and having other problems like ADD, ADHD, bedwetting, other developmental issues. They can't focus, they're at school and they're disruptive at school. And then what do? They give them a prescription. They're medicating these kids and they're not getting to the root cause. So for us, so important when we built this new facility for Smile Body was to have that component to start them early at the ages of 5 or 6. We are looking at their arch development. We are expanding the arch for these kids because a lot of times these arches are collapsed because of not only diet, but thumb sucking, pacifiers. These things collapse the arch. And yes, it might be convenient, but it's creating problems in these kids' development. Anyway, so you see what I'm getting at. So the kid component is a big aspect to this. Sleep apnea for adults is a big aspect to this as well. So for us, these are all things, as you can tell, I'm very passionate about.
Yeah, I can tell.
And I can keep talking about it. It makes a huge difference.
Well, your love for what you're doing is very evident.
We all in humanity at this point of our lives have to do something we love. If we are really do things that we're passionate about and we try to actually continue to grow and make a difference and contribute to our community and to our society in a positive way, whether it's through biological dentistry or through making a podcast that, we're bringing current information to people, you're doing something you're passionate about. And it makes a big difference, I think.
It does. Thank you for noticing. And thank you for what you do too. I'm just one person, but I felt like they all put a mark in the chart that's like, we might have to fire this one. So I'm going to go off and figure out if there's a biological dentist in Austin. There's probably plenty.
What I would do, one of our main academies, the biggest academy is called the IAOMT, IAOMT.org.
Okay.
Now you can go to the IAOMT.org and actually they'll have a directory of people that have go through that are members. They might not be the most experienced biological dentists, but at least they'll be focused on the right things. What we do a lot of times, I'm involved with training other biological dentists, but also I do a lot of telemedicine. So we see patients from around the country, actually. I will do telemedicine. One of our main diagnostic tools is something called a cone beam CT scan. A cone beam CT scan, it's a 3D image of your jaw, okay? Now, for a biological dentist, this is a must because this is how we find a lot of infections in the jaw that are overlooked with regular two-dimensional x-rays. We find certain infections on root canals, for example, that are overlooked, that are causing maybe sinus infections or other infections throughout the whole body or constant inflammation throughout the whole body, but also something else called cavitations. If you've had wisdom teeth extracted, which most of us have, a lot of times that bone doesn't fill into that space properly, and it becomes an empty space with fatty tissue. If you remember what fatty tissue holds is toxins, right?
Stores toxic things.
So then these areas become filled with toxins and are constantly dripping it back into the system slowly, causing inflammation and toxicity throughout the body, leading. And if you do PubMed on cavitations, it's linked to autoimmune disorders and cancers and a lot of health issues. So again, these are things that, guess what, we've never been taught in dental school. We've never been taught about cavitations. For me, as a biological dentist, we do these cone beam CT scans inside the office, but when we do telemedicine, we have them go get a cone beam CT scan somewhere in their area by an oral surgeon or other doctor. And then we do a video call and just kind of review it with them and look for any source of toxicities. These are patients a lot of times that are having health issues, that are having some chronic health issues.
There's a very famous podcaster that I listen to who many people know. Anyone our age definitely knows this person. And he recently said that he had a 360 scan of his head and that they discovered an infection somewhere above his teeth and they treated it. And he had been wearing hearing aids because his hearing loss was progressing for years. And as soon as they cleared the infection, he could hear again. He thought he was going deaf, and that's not what it was at all.
This is the thing. Again, the technology is there. We're just not taught this in school. My goal is to get the message out. If we all do our best, we can make a difference. That's my goal.
What's it like for you when you resolve somebody's issues with the work that you do?
It's really special because, when like, for example, the patient I told you about earlier about the heart palpitations from New Mexico, seeing her and her husband just hugging each other in tears after 20 years of going to doctors and doctor and having no answer. I mean, it's just heartwarming. When I was doing cosmetic dentistry, one of the things I loved, and I still do it, but it's just not my focus, is the fact that patients, it changes their lives so much. You're having insecurities, you don't feel confident. And when you don't have confidence, it debilitates your potential in so many ways. So when you see someone regain their confidence, that's powerful. But if you couple that with improving their health, there's really no limit for that patient. There's no more limits.
Okay, before we go, I'm sure you could talk for another hour, but I'm sure you also have patients to see.
I do.
Tell us where we can find out more about you, your website, and any socials that you want us to go follow.
Well, our practice name is Smile Body, but our handles on social media and our website is My Smile Body. So if you go to Instagram or all the socials at My Smile Body, and our website is www.mysmilebody.com, and you can get a lot more information. You can see really what we're all about. See pictures of this practice I was just talking about, our clinic, and see what it's all about.
I'll make sure we link to everything in the show notes to make them easy to find. And I have a feeling we're going to see you again somewhere. Thank you so much today for joining us, Dr. Javid. I really appreciate it.
No, my pleasure. And thank you for having me. Thank you for your work that you're doing and getting these messages like this and others out, making impact.
It's my passion.
Well said.
There's no substitute for meeting in person, but we hope this comes close. If you're considering this dentist, be sure to let them know you heard them on the Meet the Dentist podcast. Check the show notes for links to this dentist's website and Instagram. To be featured on Meet the Dentist, book your free recording session at meetthedentistpodcast.com. Meet the Dentist is made with love in Austin, Texas, and is a production of The Axis, TheAxis.io.